Hello, everyone. This is Tambar. Welcome to our peptide weight loss webinar today. As we get started, if you have any questions, please type them in. If you're live on Zoom with us, type them in the chat or on any of our social channels where we're currently watching. Please do that as well. Give me a moment. Can you hear me loud and clear? And I'm going to start. I'm told that all wonky right now, so please just give us a moment. Okay, so here we go. And again, as we're discussing, please enter any questions that you may have, and I'll certainly answer as we're going along. So, today we are talking about our physician-assisted weight loss program with semaglutide, a peptide approach. Essentially addressing obesity for better health. Okay, great. So today's talk, we're talking about our signature weight loss program that includes utilizing peptides, lipotropics, and a health coaching plan as well. So obesity, let's first talk about the scope of the problem. Obesity is a global problem, impacts our cardiovascular health, metabolic health, immunologic health, overall well-being, and of course, our musculoskeletal health. A very large number of people around the world and in the US are considered obese. I think we know that these numbers are very high. In this presentation, we are exploring a physician-assisted weight loss program utilizing the peptides such as semaglutide and tirzepatide to address obesity and its associated health effects. So obesity significantly increases the risk of various health complications. In the musculoskeletal system, all the time, I see people who've got chronic knee, hip, ankle, and back pains that have a contribution of that coming from their excess weight, and some of that improves as they're able to lose weight. Certainly, cardiovascular health effects are affected in terms of high blood pressure, heart disease, metabolic effects such as your blood sugar, high blood pressure again. Metabolic effects are connected with a number of other things. They're connected with immunologic stuff, meaning your autoimmune condition can be worse if there's excess weight. There's even some evidence that neurocognitive issues like Alzheimer's disease can actually be improved with GLP-1 agonists. We know that certain cancers can be increased in obesity as well. And of course, sleep apnea, which is connected with heart attacks as well. So we need better options and solutions for weight loss. Obesity has such long-term side effects. We need better options for individuals and for our society as a whole. There are a lot of limitations with our traditional methods, including that diet and exercise, while they are essential, they're definitely not adequate for most people. And in fact, a lot of conventional weight loss options are very limited or lead to unsustainable results. And the reason why is because weight loss and obesity they're more complicated than what we've thought in the past, meaning that there are biological effects, environmental effects, and psychological effects. And really, to help treat somebody to lose weight, it's really treating all of those issues. So our physician-assisted weight loss program is comprehensive, approaches things in a 360 manner, trying to address obesity and your overall health. So in trying to improve, our goals of treatment here are certainly to lose weight, but in that regard, we want to improve body composition, meaning reducing fat, maintaining muscle mass, reducing visceral fat, improving your cardiovascular risk factors, improving your metabolic health, improving your exercise ability, your eating habits, your immune health, your gut health, and even sleep and stress management. So there are 3 ways that diet can help with weight loss. You can just eat less calories, right? Your total intake can be less than your total output, thus resulting in weight loss. You can eat less of specific foods, right? But the challenge is which foods. In the lay press, you'll see everything from people that are strictly carnivore, where they're only eating meat pretty much. And then there's people who are 100% vegan, where they avoid any meat and only do plant-based. And the reality is that each person is a little bit different. When you look at various medical societies, they'll recommend something like a Mediterranean diet, which generally means a lot more legumes, vegetables, avoiding processed foods, high sugar foods, doing leaner fats, doing more fish, lean fats like chicken rather than red meat. And so it's a more moderate diet and is probably a good option for a lot of people. And then, of course, is eating only during specific periods of time, which would be called intermittent fasting. The most popular intermittent fasting would be you're fasting for 16 hours and eating for 8 hours. And really what that means is that, and those 16 hours, half of that is while you're sleeping. It really means you're basically waking up and your first meal's at 10 a.m. and your last meal's at 6 p.m. Very reasonable. And so all 3 of these strategies can help. And all 3 of them can be a challenge, but all 3 of them can benefit with peptide therapy. So what are peptides? Peptides are naturally occurring molecules of proteins that act as signaling molecules in the body. That means is that these are proteins in your body that tell your cells what to do. So GLP-1 or glucagon-like peptide 1 is a naturally occurring gut hormone that regulates your appetite, insulin secretion, and energy metabolism. There are other peptides as well. So semaglutide targets GLP-1, but there's other peptide targets as well. And so you'll see that in tirzepatide, and there's newer versions of peptides that are coming out that affect even more receptors. And the point is that there's a range of different ways to treat weight loss that can be very effective. So these peptides have a really key role in your blood sugar control. They help by stimulating insulin release and by also reducing the amount of blood glucose that's produced as well. They also have a key benefit in terms of bringing in the blood sugar into your muscles as well. So very helpful in terms of glucose, diabetes, and your metabolic health. Again, if metabolic health is off, meaning you're running a little bit high in blood sugar, it does lead to more inflammation. So we talked about semaglutide, GLP-1 analog. What that means is that it mimics your naturally occurring GLP-1. And it has been shown that this treatment is very significant in promoting weight loss and improving metabolic health. So again, how does this work? Improves your glucose homeostasis by pulling glucose into your muscles, so it's not just sitting in your blood. Number 2, it helps to slow down the motility of food through your gut so that you're not feeling that you're as hungry immediately, and it reduces your appetite. So it reduces the neuropeptides that are associated with hunger and increases the neuropeptides that are associated with satiety. So you generally feel like you're not as hungry all the time. That's one of the main things that you hear about people who are taking semaglutide, that they just don't feel as hungry because that prior drive for hunger is no longer there. So mechanism of action, again, we've been talking about this, controls your appetite and weight through the brain-gut reaction. We know that after you eat, your body's releasing GLP-1, and that leads to a slowing of stomach emptying, reducing hunger sensations, helps you to feel fuller sooner, reduces food cravings, food preferences. That's key. I think for a lot of people, for most people, right, there are certain foods that just act as a trigger for us. And this helps to actually diminish that. And even just kind of that preoccupation about thinking about food as well, which I think drives a lot of overeating. So the FDA has approved semaglutide and tirzepatide for type 2 diabetes and chronic weight management in adults. For chronic weight management, it's a couple different things. It can be if your BMI is greater than 30, and BMI is it's an incomplete assessment of weight, but it's one that's popularly used in the medical literature. Or you can have a BMI that's greater than 27, and you also have one other weight-related problem. That can include high blood pressure, diabetes, cholesterol, wear and tear arthritis, fatty liver, prediabetes, heartburn, PCOS, hypogonadism, or asthma. Other potential uses, preventative uses, possibly in the future, could include cardiovascular disease. Why wait until you've already got diabetes and heart disease? Can you do something about it now? Prediabetes, neurodegenerative disease. There's some early evidence that in people who are taking semaglutide, that they were less likely to develop Alzheimer's and less likely to have more severe Alzheimer's. And so this may be an anti-aging product at some point, and to help with metabolic syndrome. And again, as we have questions, please shoot them in and we'll go ahead and address them. So in terms of dosing, these are given as a weekly injection you give yourself, subcutaneous injection. We'll show you how to do this. It's not very hard. You start on a very low dose, and then every month as needed, we slowly increase. And we'll talk about why it's important to slowly increase in a little bit. So you want to monitor your weight monthly, your appetite, and observe for any side effects. I do recommend checking some metabolic health labs at baseline and then every 6 months. So the results from clinical trials are very, very exciting. So in various trials looking at semaglutide, you find that there's an average weight loss of 15 to 20% at the 1 and 2 year mark. And you find that these results are persistent over time as well. The key is that if you combine it with good nutrition and regular exercise, you'll maximize your results and you'll stay healthier long term. So in terms of side effect profile for semaglutide and tirzepatide, both have a very favorable safety profile thus far. And these are now studies that are looking at this over a few years now, right? I mean, the original studies for semaglutide came out actually quite a few years ago. Most common side effects, however, are GI symptoms. Normally it's mild, like nausea and constipation. However, if you're already on treatment and you're starting to notice that you have a lot of GI symptoms, make sure your prescribing physician knows in case they need to stop the medication or check to see if there's anything else that's going on. The keys with semaglutide and tirzepatide are that you start on a low dose, and every month as needed, you slowly increase the dose. The reason why I say is as needed, if you're appropriately losing weight and appetite is suppressed, then you don't necessarily need to go up on a dose every month. On the other hand, if you're tolerating it and you're not quite losing enough weight or suppressing your appetite enough, then escalating the dose makes sense. Lipotropics, this is another option that we have for patients. This is a substance that helps in the breakdown and metabolism of fat in the body. This is a combination of various vitamins, supplements, and amino acids that are listed there. A lot of benefits. This helps with your energy level, liver detoxification. Important because your liver should be spending its time basically working on helping to metabolize your fat and cholesterol. This aids in weight loss. It improves heart health, enhances mood and mental clarity, supports hormone balance, boosts immunity, and also improves joint health as well. It's a very low risk and nice either option on its own or as a augment or working synergistically with the peptides as well. So this is a intramuscular injection you give yourself once per week. Again, combined with peptide treatments, it's nice for weight loss. Again, they help by mobilizing fat from adipose tissues, enhancing the liver's ability to metabolize fats, supports the liver function to remove fats and toxins from the body, reducing your cholesterol levels by promoting conversion of cholesterol into bile acids by the liver. And again, lipotropics you can utilize on your own. On their own, they're not as strong as the peptides, but they can still work. In combination with the peptides, you get kind of an extra kick as well, which I like. The last bit of this is health coaching. So we've started to work with an organization called Flair Health to help us out with nutritional health coaching. They focus on education and accountability, meaning you're trying to do something that's good for you, losing weight, getting healthier. It helps to sometimes have someone who can kind of be there keeping you accountable. There's some studies that say that in order to create a new habit, it takes 60 to 90 days. And that also includes if you're trying to change your dietary habits, trying to start a new exercise regimen. And I think health coaching is helpful in creating those new habits, not only from the educational end, but in terms of making sure you're actually following through with it. So the key to optimized treatment, peptides plus lipotropics plus exercise plus nutrition helps with the most weight loss. When it comes to nutrition, you want to eat nutrient-dense food. You want to avoid overeating. By nutrient-dense food, we mean food that is good for you, that has the proper vitamins, that has the proper things that you need in your body, as opposed to junk food, highly processed foods that are really not nutrient-dense and are not very healthy for you. And then, of course, exercise. You need to be doing cardiovascular exercise to help with weight loss and improve metabolic health. But you also want to do strength training because, number one, your muscles will help to burn fat as well, burn calories. And strength training also helps to prevent from muscle loss as well. Okay, great. So in terms of frequently asked questions, here's the things that we hear from patients frequently. First is, how long before I see weight loss? It's a great question. And most patients should be noticing early weight loss in the first month. But that initial phase, what we recommend is you really want to give yourself minimum 3 months. I really recommend 6 months. And the reason why is because we start in a low dose and we slowly increase it as tolerated and as needed. And so you'll probably notice some early weight loss in the first month, a little bit more in the second month, a little bit more in the third month, and just progressively more and more. So how much weight can you expect to lose on average? On average, based on the studies, it is 15 to 20%. That's appropriate for some people. Maybe that's too much in some people. Maybe some people need to lose a little bit more, but those are reasonable expectations. And again, how long do you need to continue treatment? We recommend as an initial period, I would say really 6 months to really see how well it's working. Studies show that peptides are most effective if you're utilizing this for chronic weight loss management. That's important because the key here is treating you chronically. And it's not about just losing weight fast temporarily and then yo-yoing back up. It's about trying to maintain this long term. For most people, right, if they lose the weight, if you just go cold turkey and stop the medication, you'll start to gain back the weight. You have to be really good with maintaining your diet and exercise once you've reached the goal. We do, however, suggest that consider doing a maintenance dose. And the reason why is it helps longer term metabolically. And if you're trying to maintain the weight loss as best as you can, the treatment does help. The peptides do still help. You can utilize a lower maintenance dosing that can be less frequent instead of every week, every 2 weeks. It can mean a lower dosage as well. Just depends on what seems to be working for you. So other frequently asked questions, do I need to eat healthy and exercise when using these treatments? Yes, absolutely. This sounds like a silly question, but what I've noticed is that for folks who've had partial benefit from treatment, but have not quite reached their goal, frequently they're not really on top of their diet or exercise as much as they should be. So semaglutide can help you establish better eating habits, and actually help you maintain your exercise habits that help to benefit you long-term as well. So you should combine all these together. So can semaglutide make your muscles and bones weaker? So it's a good question. The thing is that if you're losing weight, it results in both fat and muscle loss. Your body doesn't really differentiate. It just sort of um, uh, takes from both of those areas. So the focus should be on improving body composition. And the way that you do that is with resistance exercises, right? So you want to eat super healthy, clean, nutrient dense food to help maintain your muscle mass and bone health. But then you also want to be doing resistance exercises, some weightlifting as well to help maintain the muscle. Very important long term. Another interesting question I've heard is, I already don't eat much. Will treatment still help? I would say yes, right? Like peptides can still assist with your metabolic health. Lipotropics on their own can still be beneficial. I think for all of us as we get older, as our metabolism starts slowing, as our hormone levels start changing over time, the reality is that weight loss gets harder and harder despite how much you may not be eating or despite how much you're exercising. And what I think is great about the peptides is that they partially work by restricting your appetite, but they also work by improving your overall metabolic health. And by doing that, that helps with not only weight loss, it just helps with your overall health as well. And I can tell you for most of us, as you start getting to your mid 40s or older, even sometimes early 40s, like these normal changes happen just because our hormone levels start changing. And it requires a bit of a different approach to prevent to kind of assist with your overall health journey. Another great question: if I stop treatment, will I regain all the weight? So the studies show that if you stop semaglutide completely, and if you stop any healthy nutrition and stop exercising, then you'll regain 2/3 of the weight loss is possible. The interesting things about that are, number one, you don't gain all the weight back, right? Number two is, why the studies that have been done to study this, why would they not continue people to continue to eat healthy and exercise? To maintain the outcome best long term, you should keep nutrition and exercise habits on point and really as good as possible. So the next question is, should you use peptides long term? I would say that, look, they help you maintain your weight loss and they also help to maintain your metabolic health. Again, as we get older, metabolic health gets harder and harder to maintain. So I think there's a lot of benefit to that. Safety studies to date look good for longer term use, and that is 2+ years. Maintenance use, again, maybe lower dose or frequency based on what your goals are. So how do peptides compare to other weight loss meds? The peptides, they lead to more weight loss, more consistently, more efficiently, and they are definitely safer as well compared to some of the older weight loss treatments that have been available. So our comprehensive weight loss assisted program, physician assisted weight loss program, offers you a personalized approach to weight management, utilizing the efficacy of peptides and lipotropics, starting with a thorough evaluation. Make sure that we're on the same page in terms of medical history, your weight loss goals, any other underlying health conditions. This is managed through me and my team, where we have a ton of experience with utilizing these treatments at this point and providing you a personalized treatment plan and ongoing support. Continuous monitoring and adjustments, touching base every month to make sure that you're on track. Adjusting your treatment as needed to optimize your weight loss efforts. And again, checking your labs every 6 months to make sure things are being done safely and appropriately so that you're not taking on any additional risk and so that you're getting the right results. So our physician-assisted weight loss program, again, offers a personalized approach to weight management, utilizing the efficacy of peptides and lipotropics. Peptide therapy starts at $450 per month, lipotropics at $150 per month. If you're combining these two treatments, there's a bundled price, so it's not quite as expensive, the combination. And all this includes medication monitoring, medication, and supplies. To join our weight loss program, you can either go to our website, chicagoarthritis.com, and find our section on peptide weight loss therapy. You can also take a picture of that QR code there, and that will take you to our website as well, where you can learn more. Wonderful. Let me just check to see if there's any other questions in the chat currently. Okay, great. Well, if there's no other questions, I appreciate everyone's time today. Thank you very much. I hope this was helpful. If you need additional assistance, please contact us anytime. You can contact us via either email, phone call, or any of our social media channels. You'll see in the chat section, you'll see where it's listed how you can schedule with us or contact us if interested. And until we connect again, I hope everyone stays healthy and live well. Bye-bye.